And now it's time for the Valley Regional Healthcare Prescription Playbook. Welcome back, YCN Sports Talk. Jeremy Stout, Andrew Zerhide. And before we get into our prescription playbook, just a quick note: Hollis Brookline versus Lebanon boys basketball Division II semifinal game will be played Thursday night at 8 p.m. That's the YCN game of the week. And Andrew, you and I will be doing that game.
Yep.
And Lebanon back in the Final Four. Last year they made it to the championship round, undefeated.
Right.
The Lebanon girls, we were at that game, winning the championship last week. Pretty exciting time.
Yeah, for the Raiders, yeah, it definitely is. Both guys and girls looking very good this year. And it's funny, both of those teams lost. Well, I know KJ Maddie's back for a little bit now, but for the most part, they lost their best player with Meredith Melendi on the girls' side and KJ Maddie on the boys. So it's pretty incredible that they've been able to have the seasons they've had with losing these players.
Right.
It's
so it's exciting semifinal matchup. That'll be Thursday night at 8 p.m. And speaking of basketball, speaking of injuries, in our Valley Regional Healthcare Prescription Playbook, we talked to Dr. Philbrick, and we talked about some of the hand injuries and how easy it is to recover, how hard, and what type of injuries. So let's take a look at that, and then we'll talk about that with the playoffs coming up, March Madness ready to begin on Thursday. Let's take a look right now.
So basketball players commonly get the jammed finger, which is a sprained finger. Most of the time those can be managed just simply with buddy taping, and you can keep on going. It does take a while. It does take a few months for the pain and swelling to go down. But with appropriate splinting, you can keep playing. The other big thing is we see injuries to the thumb, the collateral ligament injury, and those sometimes do require surgery for those patients. But with appropriate timing and appropriate rehab, you can get out there and continue doing what you love about 6 weeks later. So the hand is pretty complex because it's small, it's intricate. We use it for gross motor, like grabbing big objects, but we also use it for fine dexterity. It's the most sensitive part of our body. It has multiple blood vessels and nerves and tendons, where the knee, it does have all this stuff as well, but we're basically walking on our legs. But with our hand, we communicate with the outside world in so many different ways. So it is a very intricate part of the human body. Being a hand surgeon, I have a close relationship with a hand therapist. It's very important to work really as a team together. So you identify the problem and you get it to settle down, but then the hand tends to get stiff if you don't keep moving. So my job is to try and fix whatever the problem is and get you moving as fast as possible, and I can achieve that with the help of a hand therapist. And so the majority of my patients do see hand therapists, and we get you moving just as quick as we can. A lot of hand injuries, even if you get a fracture, so say for soccer, for example, if you get a fracture in your hand, you can have it casted, even if you had surgery, and you can go back to playing sports. In football, I've seen some football players at the college level have a metacarpal fracture, which is in here, have a plate and screws, and within a week with a cast, they're playing football again. So the hand is pretty unique because we can protect it, and it sees less stress. Basketball is a little different though, because you need to have the finesse of that. So you usually need to stay out a little bit longer with basketball, but football, you get back pretty quick. So to get a patient back into the game, first we want to figure out what the problem is. We want to treat it appropriately, and then have them see the hand therapist and work as a team. We have a great therapy department at Valley Regional Hospital. They work closely with us, and patients have great satisfaction, and they're able to get back into the game quicker. At Valley Regional, we have a unique team approach where the physicians will see the patients, and the therapists will also work one-on-one with the person to get them back to what they enjoy. I'm Dr. Philbrick, and I'm happy to be here at Valley Regional Hospital.
All right, there you have it, Dr. Philbrick, the Valley Regional Healthcare Prescription Playbook. And Andrew, obviously, like we said, basketball season, March Madness, Celtics playoffs, possibly. You got to stay away from those hand injuries.
Yeah, in basketball, it's very common. A lot of jammed fingers, thumb injuries, a lot of passing, catching the ball with your fingers out. You see that a lot with basketball, and
I'm sure we'll see some injuries in the tournament.
Absolutely. Yeah, it's going to happen. And these players got to be aware of that. Got to stay healthy throughout the entire tournament. It's going to be a long one. It always is. So.
Right, and also, though, they may be able to recover, not faster, but, you can isolate certain areas, I'm sure, and the tournaments, even though it kind of happens quickly, Thursday through Sunday is the first 2 rounds, but it gets drawn out for about 3 weeks. So you can injure yourself in the first round and recover later.
Right, yeah, there's definitely enough time, and if you're one of the better teams, you're obviously going to be playing longer. So, yeah, it's not like... if you get injured in the first round, you're going to stay injured throughout the rest of the tournament. But it's definitely something.
And it's not a back injury, a big leg injury.
Right,
so
yep.
It'll be interesting to see. We'll be back next week with some more of the Prescription Playbook, sponsored by Valley Regional Healthcare. We'll take our final break. When we come back, we will get into the NCAA tournament and our Salt Hill Pub picks of the week. You're watching YCN Sports Talk.